Good morning, everybody. I see I've got 2.5 minutes to talk about this. So if I speak quickly, I apologise, but I'll try and be clear. Very grateful for Tony for all the work putting this year together and putting the slideshow together. And it's great to have a news here as I say, the kind of founding kind of member. I'm a kind of, came along lately. I've only been here about 9 years involved, I think. So I missed out the first one, which I think was at Musselburgh, if I'm right, the first kind of People's Health Assembly, was that right? Yeah, and I found out, it was one of those things where you find out something's happened, like the day after it's happened, you're thinking, but since then I've managed to hang about. So this is a little bit for those of you who might not be aware of the kind of the history of the People's Health Assemblies and this wonderful organisation, which is so important to have this kind of force for good. I always kind of see it, and to be able to see international movements, because solidarity across the globe is such a challenge. I think PHM is one of the examples of where it works really well. So we've got this kind of history. I was actually speaking to somebody from Colombia earlier on this week who's involved in kind of peacemaking out there. And again, if you look at the countries that have been involved, you can just kind of see the spread of where some of the most, egregious, health inequalities, etc., are hitting people, but they're fighting back through actions of solidarity like this. So it's a great honour. We never think we have our kind of People's Health Movement in Scotland. We think you feel solidarity with people across the world. So we're very fortunate to have such an organisation. So these, right to health. Again, I don't want to go with too much stuff that you'll be familiar with. But for me, as somebody who works predominantly in education and sort of community development, is this broad understanding of health and how it runs through everything, rather than the kind of medical model, kind of social model of health. And the sort of decades since kind of PHM has been in here, we've obviously had the COVID epidemic, etc. So all these issues that people have talked about just seem to become more and more crucial all the time, unfortunately. Gender and reproductive justice, we can see the retrenchment of that in areas like the States and other countries across the world. But, the fact that we're looking at global, national and local action, I think, again, is one of the kind of fairly unique elements of the People's Health Movement, and it's vital. Obviously, that kind of social movement building part is, I was talking to Sue earlier on, and we were saying that she had gone to see a guy called Jonathan Porritt, who is a kind of been working for years, used to be Friends of the Earth, I think it used to be heads of Friends of the Earth, and kind of went into this kind of area talking to the, would be Prince of Wales, but now is King Charles, and trying to influence people in that kind of elite level. And of course, it has absolutely no impact whatsoever. And so people kind of realise that any kind of progress is taken from below, not handed down from above. And I think that kind of shown in the work that PHMS do. But also the kind of range of approaches. And we'll see that in the kind of work that the People's Health Movement Scotland have been involved in. So there has been a lot of work over the years, and the specific examples that we'll show you around trying to link in to political developments like the Scottish Parliament elections, UK elections, etc. And just to remind anybody here that Scotland voted overwhelmingly to stay in Europe, and we still are, of course, in Europe. We're just not in the EU. But it's seen huge impacts of Brexit, again massively impacting negatively on health. So those, the political fallouts of the rise at the far right have been across the UK and very much impacting cities like Glasgow. So this is just the kind of range of events that we've been involved in. And really, I'll just give you the People's Health Manifesto, the original one in 2016. So 10 years later, we'll be looking for a new one to put forward to. And as Tony says, we'll have a lot of information to add to it for from the inputs here. And I think it's so important that there are alternative positive images of what people could do, because the policy realm is so captured by corporate visions of what is possible, what is impossible. So these kind of documents, where we bring a wide range of perspectives together, are hugely important. And again, trying to, Scotland's, I think, got a kind of slightly schizophrenic understanding of community empowerment. Because on one level, on a policy level, it's got a lot of, there's a Community Empowerment Act, there's Scottish Health and Care Partnerships, there's a lot of talk about co-production, there's a lot of this kind of language in policy. As someone who's worked on the ground over 20 plus years, and there'll be other colleagues in here that experience the same thing, it really doesn't deliver on those policy outcomes. We still, people don't want to give up power, and people, austerity has been one of the kind of key barriers to kind of achieving any of the kind of reality of these kind of what on one level would look, and often it's easy to work in Scotland and feel like things could be so much better, and then somebody comes up from England and says, "Oh, this looks a lot better than what we've got." But we must keep our demands and our vision ambitious, because it doesn't feel ambitious; it just feels like justice, and that's what we're struggling to achieve. So the manifesto was a really important kind of starting point, foundation, if you like, for the work of the health movement. There's Sue there with is that one of your Kiefer's on, I think, maybe, at the corner, or a scarf. But I remember this particular event was one of the first ones I've been involved in. I remember speaking to somebody who, in the audience, and they were really concerned about the fact that if you get chemotherapy in Scotland, there's no separation of waste. This was a kind of nitty-gritty kind of thing. There's no separation of waste like you do in other countries, So all the kind of chemicals from the chemotherapy are just put into the public water supply. And for me, it sort of shows the kind of strengths of the People's Health Movement, is that we can take people with very specific issues, which are also crucially important because it's such a complex area. But we can embed those in the wider concerns around neoliberalism, around the privatisation of health, etc. So it allows both the fine grain and the wide picture to come together, which is hugely important. I didn't manage to make it to this one. I don't even know if the World Justice Festival is still running. I might have been a victim of COVID, but certainly there was a regular World Justice Festival that took place in Edinburgh. And this was one of the things that we try and do with People's Health Movement Scotland, is go and support others. So we don't expect everyone to come to us. We go out to them and try and support the other work that's going on in the area. And here, this is Gavin and some of the folks from Active Inquiry. So the public hearing, again, this was work that Neil and News was News involved? Yeah, it was involved in that again.
And the Alliance are here today.
And the Alliance. So again, it's really interesting to see the range of different approaches. So that again was about giving voice to people within the policy and aesthetic about what the lived experience of people experiencing health injustice. And using, I'm a big fan of the Theatre of the Oppressed, so that's what Active Inquiry do. And they have actually got a big 4-year arts-funded campaign on using legislative theatre to engage people in local democracy. So again, the role of democracy, that will come up in one of our roundtable elements, is obviously crucial to what kind of policies actually get even into the public eye, so people can be engaged with them. This is me being brief, sorry. So again, having the Civic House statement was a brilliant event that we had literally 2 weeks or something before the COVID. shut down here, I think, if I'm right, was it not? I'm getting confused.
That was later.
What was the other one? Anyway, well, that was another thing. The Civic House statement was a really well-attended, broad range of people across the board. And we had people like Ellie Harrison, who does a lot of work around public transport. So she does a thing called Bring Back British Rail and also Get Glasgow Moving, which is all about the kind of municipalisation of the public transport system. So again, these kind of very crucial, but often left out of the kind of general discourse around health. So these kind of reports are trying to keep this wider understanding of health, both in the remit of civic society and trying to influence politics as well. And now I get to hand over to the brilliant Tony Robertson, who will talk about where we are now. So thank you very much. Cheers.